My name is Justin Dahlgard. I'm a SHIP counselor and resource specialist. I'm going to be explaining the basics of Medicare. If you need to reach me, you can contact me at 406-438-7793 or by email at jbelgard@rmdc.
Hi, I'm Anita Linden. I am a SHIP counselor at Rocky's Agency on Aging. I will help you with your Medicare, and I also help with information and assistance. Please call me at 406-457-7358. Welcome to Medicare. I am Anita Linden. I am a certified SHIP counselor.
I'm Justin Dahlgard. I'm also a SHIP counselor.
We'd like to give you the basics on Medicare, the A, B, C, and D's of Medicare. Medicare is your health insurance for citizens who are over 65 or over 65 and have retired. People under 65 are sometimes eligible for Medicare if they have end-stage renal disease, Lou Gehrig's disease, asbestos-related lung disease, or they have been on disability and received Social Security disability for a minimum of 24 months.
Medicare basics. Part A is hospital insurance. Part B is medical insurance. Part C is private insurance options. Managed care, Medicare health plans, and Medicare Advantage plans. Part D is prescription drug insurance and supplemental Medigap insurance. Social Security Administration's role in the Medicare program. Social Security determines eligibility and entitlements. They provide program information to the public. They determine eligibility for extra help with Medicare Part D. SSA does not handle billing and coverage.
When can you enroll for Medicare? People new to Medicare will have an initial enrollment period, the IEP, for 7 months. It begins 3 months prior to the month you turn 65, the month you're 65, and 3 months after your 65th birthday. For some people or spouses who work past age 65 and have employee-sponsored health care, have a special enrollment period, the SEP, for 8 months, which begin the month after the employment ends or your current employer insurance ends. If you're not automatically enrolled, there's a 7-month initial enrollment period. If you enroll in Part B and you enroll 3 months, 1 month, or the month before, your Medicare will begin on the month you turn 65. If you enroll the month you turn 65, 1 month after you turn 65, 2 months after you turn 65, or 3 months after you turn 65, your Medicare will start 1 month after the month you enroll.
General Medicare enrollment. If you miss your IEP or SEP, you may sign up for Medicare during the annual enrollment period. January, February, and March of each year. You have to pay a higher premium for late enrollment. How do I start Part A? Most people automatically get Part A. If you already received SSR retirement. 2, if you have been on SSD for 24 months. 3, if you have met entitlement criteria. You will receive your Medicare card in the mail 3 months before your 65th birthday or your 25th month of disability. What if I do not meet automatic enrollment criteria? Visit the Social Security office to apply for Medicare. Enroll online at www.ssa.gov.
Medicare costs for Part A. Most people generally are entitled to a free Medicare Part A. You must have worked at least 40 quarters or more, which is approximately equivalent to 10 plus years of Medicare covered enrollment. employment, excuse me. There is a voluntary enrollment for people who are not entitled to Part A and choose to pay a monthly premium. Medicare Part A helps pay for hospital stays, skilled nursing facilities, home health care, hospice care. It generally has certain coverage criteria must be met. Deductible and copay structures and beneficiaries do have certain rights and protections when coverage is denied. Medicare Part A hospital stays has coverage criteria, a deductible per benefit period in 2023 will be $1,600. Copayments per benefit period for days 1 through 60 there is no copayment, but days 61 through 90 you have $400 per day that you will be required to pay, and days 91 through 150 are $800 per day for 2023.
Medicare Part A, skilled nursing facility care. Coverage criteria. Annual cost. The first 20 days may be covered in full. Days 21 to 100, copay of $200 a day are required in 2023. After 100 days, Medicare Part A no longer covers skilled nursing facility care. If only one personal care is needed, it will not be covered by Medicare.
Medicare Part A, home health care. There is coverage criteria. Home health care is ordered by your doctor. Services will include part-time skilled nursing care, physical, occupational, and speech therapy, which I need there, home health aides, durable medical equipment, referred to as DME. Generally, the beneficiary pays nothing except for the durable medical equipment at a 20% of approved Medicare amounts. Medicare Part A includes hospice care, provides palliative care for people who are terminally ill or expected to live for less than 6 months. You must have a doctor's certification for that. Also, it provides some supportive services to family givers. We have respite care and grief counseling under there. All right, here we go.
How do I start Part B? Enrollment criteria is the same as Part A. Enrollment into Part A and B occur at the same time. However, there is an option to decline Part B. To decline Part B, read the description on your Medicare card.
The directions.
Yep.
Okay.
Medicare Part B, medical insurance. And that includes physician services, outpatient hospital care, medical equipment and supplies, ambulance transportation, some other medical services, annual physical and prevention plan. Medicare Part B, medical insurance, does not pay for routine eye exams, glasses, or hearing aids, routine foot care, dental care, or long-term care.
Medicare costs for Part B. The premium for 2023 has gone down. It is $164.90 per month for most first-time enrollees. The deductible will be $226 per year, and the co-insurance remains the same, generally 20% of Medicare's approved amount. Assistance with Medicare Part B cost, we have the Medicare Savings Program. You can apply through the Office of Public Assistance. You must be 65 or older or disabled, a Montana resident, have a Social Security number, and meet income and resource guidelines. There are 3 types of assistance. We have QIMBY, which pays for the Medicare premium for A and B, the deductibles, and the co-insurance for your Medicare. We have SlimB and QI, which benefits include payments for Part B premiums.
Assistance with Medicare Part B costs. Medicare Savings Program. You may qualify if you're single, your monthly gross income limit's less than $1,153, your resource limit's less than $8,400, couples, monthly gross income less than $1,546, and resort limits less than $12,600. Medicare Part B, preventative benefits, physical, smoking cessation, cancer screenings, mammograms, shots, colonoscopy, exams, medical nutrition therapy, and much more.
Medicare Part D, prescription drug plans. Part D benefits are offered by private insurance companies. Prescription drug plans, or PDPs. Medicare Advantage plans, most of them have a prescription drug benefit and would be included in your Medicare. Part D, you'll have the same initial enrollment period, which are the first 3 months before you turn 65, the month you turn 65, and the 3 months following your 65th birthday. And we have the same delays in starting your Medicare based on when you enroll. There's no delay if you enroll the first, second, or third month before your birthday. If you delay your enrollment and you start the month you turn 65, or the first or second or third month after you turn 65, it will be delayed by 1 month after the month you enroll.
Medicare Part D, assistance with prescription drug costs. Social Security Administration offers extra help, premium assistance, and lower prescription drug costs. If you're single, annual gross income less than $20,385, and your resource less than $15,500. Couples, annual gross income less than $27,465, and your resource less than $30,950. Medicare Part D, assistance with prescription drug plan cost. Montana Department of Public Health and Human Services Big Sky RX program. Premium assistance, single, annual gross income less than $27,180, and couples, annual gross income less than $36,620.
Medicare Part D, common mistakes. Staying with the same plan every year, choosing the same plan as your spouse, choosing a plan based on name recognition, example, calling an 800 number that you see on TV, not signing up for a plan because you don't take any prescription drugs or because you don't think you need one. Open enrollment period is October 15th to December 7th every year. It's an opportunity to compare your plans for the next year. Part D, Advantage plans, and Original Medicare, and a Medicare supplement policy, if you qualify, is done during open enrollment. There are ways to compare plans. Number 1, Medicare Plan Finder at medicare.gov, 1-800-MEDICARE, or a SHIP counselor.
Financial penalties for late enrollment. For Medicare Part A, 10% monthly Part A premium increase to be paid for twice the number of months the individual delayed enrollment. Medicare Part B, 10% monthly premium increase for each full year enrollment was delayed. Medicare Part D, 1% of national median plan price for every month not enrolled in Part D plan.
You decide how to get your coverage. We have Original Medicare Plan, which has Part A, Part B, and Part D, and if you decide, you can purchase Medicare supplemental insurance. Or we have a Medicare Advantage Plan, which is called Part C, which combines Part A, B, and D, which includes the Part B premium that you will pay the same as on Original Medicare. For 2023, that is $164.90 per month. Premium plans vary, and they include Part D premiums. Sometimes it's usually broken down as one price, but when we compare them, it shows the difference in the prices. They have co-pays, out-of-pocket expenses vary, and they all vary by price, but the general consensus, they have to offer everything that original Medicare offers.
Supplemental medical insurance, Medicare insurance, Medigap. What is covered? Help with out-of-pocket costs such as deductibles and copays for the original Medicare Part A and B. Different plans with different coverage ranging from basic benefits to complete coverage. Plans are standardized, providing identical coverage regardless of the company. Supplemental Medicare insurance. Premiums vary based on age and amount of coverage. Some plans tie premium cost to initial purchase. Some plans increase premium level as age increases. Deductible and copay amounts depend on the plan purchased. Supplemental medical insurance. Consumer protections. Open enrollment period 6 months after Part B begins. Guaranteed insurance rights, no underwriting for pre-existing conditions.
Who pays first? Medicare will be your primary and to the supplemental / Medigap and retirement health insurance. Medicare is secondary to employer-sponsored health insurance in certain circumstances. Medicare Part C, Medicare Advantage plans and Medicare health plans. Plans combine Part A, B, and possibly D in a private insurance policy approved by Medicare. You still pay the Part B premium to Social Security. Health care coverage is identical to that provided by Parts A and B. You're not allowed to purchase a supplemental Medicare insurance, the Medigap. Medicare Part C, continued. Structure copay system. They have deductibles, and you may receive additional benefits such as vision, dental, and hearing, but are limited. May have additional monthly premiums. There are PPOs, preferred provider organizations, which have in and out of network providers, an HMO, which is a health maintenance organization, which generally you must see their specific provider.
What's new? More covered preventative services. Screening and counseling for depression, alcohol misuse, cardiovascular disease, obesity, and much more. More help in the prescription drug coverage gap, the donut hole. Medicare fraud. Medicare does not contact you for any reason. Fraud issues and concerns? Contact Senior Medicare Patrol, Rocky Mountain Development Council, 1-800-551-3191. SMP focuses on educating consumers on Medicare paperwork and preventing waste, fraud, and abuse. New Medicaid cards have been mailed. If you are on Medicare and you have not received yours, call Medicare at 1-800-MEDICARE 4227. New Medicare number are not tied to anyone's Social Security number, but still need to be protected. Scammers are calling and claiming to be from Medicare. They have various lines such as they must confirm the Medicare number before sending a new plastic card to replace the old paper one. Medicare will not call.
And this is a description or a likeness of a regular Medicare health card. Any additional questions, contact your Montana State Health Insurance Assistance Program, SHIP, 1-800-551-3191 to reach your local area Agency on Aging or SHIP counselor.
You can reach Justin at 406-438-7793.
Anita Linden, 406-457-7358. SHIP provides one-on-one counseling to Medicare beneficiaries and their caregivers. The Medicare hotline is 1-800-MEDICARE 4227. Social Security Administration, Helena, is 1-866-563-9496. And Bozeman, we have 1-800 772-1213. I think that's the same one. We have resources, Medicare, www.medicare.gov. Medicare also has www.mymedicarematters.org. For Social Security, we have www.ssa.gov. Screening programs for benefits, you can do www.benefitcheckup.org. We have the Commissioner of Securities and Insurances, www.csi.mt.gov. We have Medicaid, www.dphhs.mt.gov/Medicaid. Big Sky RX 1-866-369-1233. Thank you for joining us today. And any questions, please make sure to give us a call and set up an appointment. We would love to help you.